So my name is Joe Scott-Jones. I'm chair of the rural chapter of the College of GPs and chair of the Rural Health Alliance, and I'm sitting on the couch here with Sharon Hansen, chair of the New Zealand Rural General Practice Network and nurse practitioner. Welcome, Sharon.
Thank you, Joe.
How's the conference been so far?
It's a great conference. It always delivers, this conference, and it hasn't disappointed at all.
So what have been the highlights for you up till now?
Well, the keynote speakers, they're always inspirational, and they just give a snapshot from other parts of the world, and they enable us to figure out where we fit.
And learning so far for rural New Zealand?
Yes, there's been bits and pieces. I've just come away from a session on the Rural General Practice Network, workforce rather, which is fascinating. In fact, I want to go back and get some more information and figure out what I've missed.
Okay.
Yeah.
Okay. So you were talking on the panel about equity and equity issues. Tell us about equity and how. What's your perception of the needs within New Zealand in order to achieve equity?
Well, I think we ignore significant factors that influence equity in this country. We really focus on the financial aspect of things. We focus on the ethnicity of different groups, but we ignore the impact of environment. We ignore the impact of differentials in financial sustainability issues. Where the jobs are, where the education is. We focus on the outcomes in the social arena, but we ignore some of the other indicators that influence that. Yeah.
So, one of the issues is around place and place of dwelling and the impact that has on access. Any particular solutions coming to you from the keynote speakers that you've heard so far?
To think about that, I would have to say they talk about the organisational aspect that needs to happen, the gathering of information, the thinking around how you put that together with some of the other aspects that are important. So having looked at some of the data that's come through from different workplaces, where the focus has been for some of those workplaces. An example was given this morning about one of the big hospitals overseas that had a focus on infrastructure and focus on practicality, but hadn't done any big picture thinking and didn't have an aspect of social focus in there at all. And then the next example was a group of nurses who had very much the opposite effect. The organisational infrastructure wasn't as strong, but they had a strong focus on the social and spiritual aspect of what they were doing. So the take-home message for me is definitely, how do we get this right? How do we look at all the aspects of what we do, and how do we make it sustainable?
So in terms of implementing change, I think it's about getting that balance between all of the different energies that we need. We do need an intellectual and a physical energy in implementing change, but we tend to put more focus on those when we're implementing change. We, as organisations, the network and the college, probably have a role in increasing the energy in terms of spiritual energy and the social energy in implementing change. I think it was interesting, wasn't it? Look forward to seeing what the rest of the conference brings, and look forward to making some changes once Monday comes around. So.
Yes.
Thanks, Sharon.
Thank you very much, Joe.